I am very honored to give this distinguished lecture. I have some pictures up here on the first slide because I want to thank many of our team members. I have an older picture of our team and a newer picture of our team. I love the older picture because we all look so good in this picture, done several years ago. I like this picture because it shows that Michelle Ono, our leader here at the Mind, along with Len Abadudo, she started out with the Fragile X team. Here are many of the people on our team involved with clinical trials, including Courtney and Jimena and Bella and many others. Andrea Schneider here, we are celebrating because she became the dean of the California State University in Elk Grove for the School of Psychology. So we call her Dean Schneider, where she works half-time and then half-time here at the Mind. But I particularly want to thank my administrative assistant, Julie Morcillo, who has been with me for almost 20 years now. If it wasn't for Julie and others at the Mind Institute, I would not be able to do the things I do that you will hear about. I also want to thank Robbie Miller. He is sitting on top of the symbol of the X in Juarez, Mexico, because Robbie helped to establish the ITPND, the International Training Program for Neurodevelopmental Disorders here at the Mind Institute. We have lots of international trainees, but he has stimulated many of our international excursions to other parts of the world to help them understand about all the advances at the Mind Institute. And here is the symbol of my husband's lab, drawn by our oldest daughter, Karen Hagerman, showing the cure sign over the fragile site on the X chromosome. So I have been at the Mind Institute for about 20 years and in clinical medicine for over 40 years. And I have learned a lot, but perhaps the most important thing that I have learned is that giving to families and patients and also to the teams that we work with, being generous and developing positive relationships is really the most important thing in life and also in medicine. I love medicine because we can help those families who we see. We always develop positive relationship with families. So this talk will emphasize the science, but also the people involved in particularly my team of people who work here at the Mind Institute. Now, this focuses on treatment of neurodevelopmental disorders, particularly Fragile X syndrome and autism. And another theme that you will see in this talk is that sometimes a treatment for one disorder will work for several other disorders, like what works for Fragile X syndrome may also work for idiopathic autism, and sometimes even medications that work for neurodevelopmental disorders may also work for neurodegenerative disorders, as you will see. So I am a developmental and behavioral pediatrician. I spent 20 years in Colorado before coming to the Mind Institute, treating the symptoms of many neurodevelopmental disorders, including autism, ADHD, fetal alcohol syndrome, Tourette syndrome, Fragile X syndrome, and unknown causes of intellectual disability. And pharmacotherapy became better and better over the years. I remember first working with tricyclics and stimulants to help with attentional problems. Then when the SSRIs, or the selective serotonin reuptake inhibitors that work on the serotonin system, came into development in the 1980s, it was like a miracle, particularly for problems like anxiety. Then the atypical antipsychotics like aripiprazole or Abilify and risperidone came during the 1990s. And this was remarkably helpful, particularly for aggression and irritability. And in fact, these two meds, Abilify and Risperdal or risperidone are the two that are approved by the FDA to treat autism at the present time. Then what has been very important is the sequencing of the human genome that has dramatically influenced medicine over the last decade, discovering the causes, many of the causes of neurodevelopmental disorders, and also more recently developing precision animal models. We heard a great lecture about that last week. This became even better with CRISPR and Cas9, the gene editing tools, along with other tools. And having animal models has led to targeted treatments, first in animals with different types of neurodevelopmental disorders, and then stimulating treatment in humans. And there has been a growing number of genetic causes in autism spectrum disorder. And in 2000, we came to the mind, really focused on developing better treatments. Now, one of the most common causes of autism is Fragile X syndrome. And the gene was discovered in 1991, actually before CRISPR or Cas9, but that developed the knockout mouse model where the gene was eliminated. And so many new treatments have been tried in the mouse and then gone on to human trials, as I will show you. It's important that every child with an autism spectrum disorder needs to have genetic testing, including Fragile X DNA testing and a microarray. And if these are negative, then going on to more sophisticated genetic testing, such as whole exome or whole sequencing. And about 60% of those with Fragile X syndrome have autism spectrum disorder. And then when we look at those with autism spectrum disorder, about 2 to 5% will turn out to have a Fragile X mutation, usually Fragile X syndrome. Now, these pictures down here shows a little red-headed infant here showing empathy towards this crying infant, and this boy with red hair has Fragile X syndrome, and those with Fragile X can have more sensitivity or more empathy compared to many other types of autism, and they have more anxiety, and this can distinguish those with Fragile X and autism from idiopathic autism. I also want to point out that often many family members are involved. So here's the grandmother of these boys here. Actually, she's the mother of these boys. And then her daughter here had a son with Fragile X syndrome, but these three boys are the sons of this woman here, and they all have Fragile X syndrome. So we see many large pedigrees. In 2000, we moved to the Mind Institute, and 2000 was a seminal year for us, not only because of the Mind move, but also this was the year that Dr. Flora Tassoni, pictured here, discovered when she was working in Paul's lab, the elevated FMR1 messenger RNA that's seen in premutation carriers. And this was published as the first article in the main genetic journal, American Journal of Human Genetics, for the new century 2000. So that was a very seminal paper showing this molecular designation of those with the premutation. This was also the year that we presented at the National Fragile X Foundation International Conference in Los Angeles, the first 5 carriers of Fragile X who have the premutation and the tremor ataxia syndrome that we later named FXTAS, or the Fragile X tremor ataxia syndrome. Here is a picture of my husband. Around the time that I married him, he was in Antarctica for the first 3 months of medical school. We're from the same medical class at Stanford. And so he came 3 months late to Stanford Medical School, but he was so cute. I knew that I had to marry him. He was a real hunk when he came to the class of medicine. And I was ready for him by 3 months into medical school. Anyway, he has done a lot, as I'll talk about in a moment, but 2000 was the year we moved to the Mind Institute to push new treatments for neurogenetic disorders. And we actually carried a brain with us. The brain was from an individual with the premutation, a grandfather who died of what was later found to be FXTAS. Now, just to give you some basics, those with the premutation are quite common in the general population, about 1 in 200 females and about 1 in 250 to 800 males, around 400 males has the premutation. The difference between the premutation and the full mutation is the premutation has 55 to 200 repeats and produces way too much messenger RNA. This is what Flora and Paul discovered. Usually produces normal and sometimes a little less or sometimes a little more of the Fragile X protein called FMRP. And those with Fragile X syndrome, about 1 in 4,000 to 1 in 5,000 in the general population, have methylation of the gene typically so that the gene is turned off and little or no message is produced unless you're a female and you're producing a little bit more message from the other X chromosome. And the lack of the message and the Fragile X protein is what causes Fragile X syndrome. And here's a typical infant with Fragile X syndrome: slightly prominent ears, large head circumference, prominent forehead. Now, the disorders that are called premutation-associated disorders include Fragile X-associated primary ovarian insufficiency, the most common genetic cause of early ovarian failure. This is called FXPOI, also FXTAS, and more recently we described the Fragile X-associated neuropsychiatric disorders, or FXAND. This typically involves depression and anxiety, but it can also involve ADHD. Occasionally we see autism spectrum disorder, particularly in boys with the Fragile X premutation, obsessive compulsive disorder, and in adulthood, sometimes chronic fatigue, and in some individuals with FXTAS, chronic pain, such as fibromyalgia. So this is what the messenger RNA looks like. Here's the CGG repeat expansion. It goes up a little bit in the gray zone, but then it can go up to 8 to 10 times normal in the upper end of the premutation. But then when you pass 200 repeats, when it's fully methylated, the message drops to nothing. But if it's only partially methylated, the message can still be present in elevated levels. But once you get into the full mutation, that causes Fragile X syndrome. And there's little to no protein in the boys, but a little bit more protein in the girls. And this is FMRP levels. Now, some individuals have what we call a double hit. That is elevated messenger RNA and low protein. And Dr. Schneider has recently reported this year about the increased incidence of psychotic thinking in individuals with a double hit. So that's an interesting new phenotype. So the Fragile X disorders not only include Fragile X syndrome. This syndrome was the first cause of X-linked intellectual disability, first reported in 1949. And then Dr. Herb Lubbs reported the fragile site in those with Fragile X syndrome. So it's a very important, probably responsible for 30 to 50% of all causes of X-linked intellectual disability. And it's the most common inherited cause of intellectual disability and the most common single gene cause of autism. And then the Fragile X disorders include FXTAS, as we mentioned, and then FXPOI, which we actually first reported in 1991 as ovarian insufficiency. And then the FXAND was more recently described in 2018. Many people in Europe don't like the neuropsychiatric disorders described as disorders, and so they've come up with Fragile X associated conditions, or FXPAC. So this is an alternative name that you may hear. But again, FXAND can begin in childhood and also continue into adulthood, particularly with insomnia, chronic pain, chronic fatigue, along with depression and anxiety. So these are the disorders. Oops, wait a second. These are the disorders that we've talked about. The most important, or perhaps the most severe, is FXTAS, because the tremor and ataxia and even cognitive deficits can progress. It affects approximately 40% of the males and about up to 16% of the females with the premutation, but it becomes more frequent with age. I have a picture here of Louise Gain, who is the genetic counselor who worked with me long-term, not only in Colorado, but also at the Mind Institute. And it was really she and Sebastian Jacquemont, who I'll show you a picture of later, who evaluated all the families known in California in 2004 and published the prevalence paper here in JAMA, which brought significant recognition for FXTAS that we named in 2003 in this article in American Journal of Human Genetics. So that brain that we took with us to the Mind Institute had was from an individual who died of FXTAS, and Claudia Greco was eventually able to identify the inclusions. I remember when she called me up and said, "Rondi, I am seeing unusual things in this brain that you brought me. I've never seen these inclusions." These inclusions are in the nucleus. They are ubiquitin positive inclusions, but tau negative. They can be seen in the neurons and the astrocytes throughout the brain, as you can see here in the amygdala. They're present in the mouse model for the premutation. And these inclusions, together with the brain atrophy and the white matter disease, particularly white matter disease in the middle cerebellar peduncles, is what constitutes FXTAS. We reported it in women, and I want to point out that Lorraine Ruiz, one of the nurses at the Mind Institute, it was her grandmother who died of FXTAS, and she was the first one that we found inclusions in women with FXTAS, and we reported that in 2004. And we have followed the family of Lorraine Ruiz ever since, with other individuals involved with premutation and full mutation. These inclusions, Ryan Hunsaker, who was a postdoc with Rob Berman here at the Mind Institute, he discovered inclusions in many other parts of the body, including the heart, the kidneys, the paraspinal ganglia, even in the intestines. We also found it in the Leydig cells in the testicles, along with all parts of the brain. So these inclusions can occur all over in the body. They are an effect of the RNA toxicity, and this is related to many of the symptoms that we have seen in individuals with FXTAS, including the inclusions in the testicles or the Leydig cells that make testosterone. We think this is the cause of erectile dysfunction, which can happen in premutation carriers very early, even before they develop tremor and ataxia. I want to point out that Jun Yi Wang, who works not only on our FXTAS study, our genotype-phenotype study, but also on the trajectory study of Susan Rivera and David Hessel. She is an amazing, brilliant woman, has published many papers, not only looking at the progression in the brain, changes in premutation carriers, which is outlined here in the light blue compared to the normals in green and compared to those who develop FXTAS in the purple here. And these brain changes can happen very early, even in childhood, subtle differences in brain trajectories. And then particularly in aging, as you see more brain atrophy and more white matter disease in those premutations who develop, carriers who develop FXTAS compared to those premutation carriers who don't. And they merge here with the normal population. She has also looked at the trajectory of the white matter disease volume over time in those with different stages of FXTAS. She also discovered the hypergyrification in premutation carriers and how that can relate to cognitive changes. Also, we can see some hypogyrification. She's described the very dramatically enlarged ventricles in FXTAS and how that can distort brain structure. And more recently, she has a paper under review related to the eye of the tiger sign, where you see iron deposition here in the globus pallidus, looking like the eye of the tiger. And this is seen in those with late stage FXTAS, but more significantly than controls. So Jun Yi has been a very important researcher, particularly in our FXTAS studies, an amazing researcher. I want to point out that Veronica Martinez Cerdeno, centered here, is also working with Maria Jimena Salcido Arellano and also with Bella McLennan, making wonderful discoveries in the FXTAS brains. And Veronica Martinez Cerdeno has a Fragile X and FXTAS brain bank, also called the Hispano-American Brain Bank for Neurodevelopmental Disorders, or the SENE Brain Bank. So all neurodevelopmental disorders, including autism, are occurring in her brain bank. So let's just look at some of their discoveries. The association of Parkinson's disease and Parkinsonism, meaning shuffling gait and slow movement, masked faces, and even resting tremor can sometimes occur in FXTAS. And particularly during this time of COVID, when we have had a limitation of those with FXTAS who could visit the mind, there have been even more studies of the brain. And of 40 patients with FXTAS who donated their brains to us, 7 were diagnosed with Parkinson's disease clinically or Parkinsonism, and all 7 had depletion of dopamine in the neuronal cells in the substantia nigra. And in 2 of these 7, there were also Lewy bodies. These are FXTAS inclusions, and here are Lewy bodies. And Lewy bodies were seen in an additional 2 patients. So overall, 10% of our FXTAS brains had Lewy bodies, and it's Lewy bodies along with the clinical symptoms of Parkinson's disease that give you the diagnosis of Parkinson's disease neuroanatomically. So this is a common comorbid feature in FXTAS, and we're doing studies now looking at the progression of Parkinsonism and Parkinson's disease in those with FXTAS compared to those that don't have Parkinson's disease. Also, Dr. Martinez Cerdeno's lab also discovered iron deposition within the putamen and other cells in the brain in individuals with FXTAS. So there's a problem with the transport of iron into the brain. It stays in the brain. It's picked up by the microglia. It's seen in neurons, astrocytes, and also oligodendrocytes. And these increased levels of iron, as seen here in the pearl stains, are much more significant than controls, not in every brain with FXTAS, but in the majority. And the immune system with the microglia attempts to remove the iron, but these microglia get activated and cause some inflammation in the brain, which is important. Now, iron deposition can also occur in other disorders like neurodegenerative disorders. There's a typical neurodegeneration with brain iron accumulation called NBIA. And we also discovered a patient with autism, and he is the only patient with autism that I've seen who needed medical chelation to remove the iron. I saw him in clinic. I sent him to Dr. Sumashankar, depicted here, and she discovered that he had a very rare type of NBIA, or a neurodegeneration with brain iron accumulation, with this mutation that was discovered with whole exome sequencing. So it's important to get this type of sequencing when you can't find other genetic disorders in individuals with idiopathic autism. Here he is in his 30s when he saw me. He was diagnosed with autism when he was age 4. He was nonverbal, but then developed some Parkinsonian symptoms in aging. And he was chelated with desferapone, a chelator that crosses the blood-brain barrier. He did somewhat better with this chelation, although his NBIA disease has progressed also. So I want to point out our FXTAS team at the Mind Institute, including Bella, who's our lead coordinator, and she's done an excellent job. We also see patients prior to developing FXTAS on the Trajectory Grant with Susan Rivera and David Hessel, who are the PIs of this Trajectory Grant, trying to understand which males will develop FXTAS in the future, and even following those when they move into FXTAS. And Jun Yi Wang has done the neuroimaging for both studies. We are following over 100 individuals with FXTAS. Our Dean Schneider published this year a paper about 53 females with FXTAS versus 55 controls, and made some really important discoveries like the middle cerebellar peduncle sign of white matter disease that's seen in about 60% of the males with FXTAS, is seen in less than 10% of the females. The splenium sign is really the main sign on MRI, showing involvement in the posterior part of the splenium. And the white matter disease can also occur in the pons, and they can also have diffuse white matter disease. The higher the CGG repeat, the earlier the onset of FXTAS in the females, very similar to what we previously reported with Dr. Leahy and Dr. Tasonis studies. This is the white matter disease in the pons, as you can see here with the arrow, but here is where the splenium is involved. And sometimes, you know, the corpus callosum here can be very thinned as the ventricles are dilated, and sometimes even the genu can be involved. And as you can see, there can be significant brain atrophy. But these in the green are what we see in females with FXTAS, and in the yellow are what we see in controls, and they're definitely more different than controls. So it's very important to get an MRI when you are concerned about the tremor and ataxia in carriers. This just shows the CGG repeat down here and the age of tremor onset, where it correlates. The higher the CGG repeat, the earlier the onset in Dr. Schneider's studies. We've also found that there can be connective tissue problems in carriers with Fragile X syndrome. particularly those at the upper end of the premutation with lowered FMRP levels, because this can lead to elastin abnormalities. These connective tissue problems are much more common in those with Fragile X syndrome. This is what gives them large ears and velvet-like skin, sometimes joint dislocations or hyperextensible finger joints. The aortic root can be dilated. John Davids reported on that early on with us. He is actually in orthopedics here at UC Davis now. But some of these connective tissue features can be seen in carriers, more common than age-matched controls. Many carriers can have back problems, disc protrusions, surgery for back problems. Those with the highest premutation levels who have the lowered levels of FMRP, we think are more involved with these connective tissue problems. Coy, one of our ITPND fellows, depicted here, has described this in a paper where we have had carriers diagnosed with Ehlers-Danlos syndrome of the hyperextensible type, who later turn out to have the premutation. Many have had other premutation problems like FXAND. And then in a more recent paper that has been published now, Forrest McKenzie, who is now in the first year of medical school at UC Davis, but he worked with us and described spontaneous coronary artery dissection, where there can be dissection in the coronary artery, and it can present like a sudden onset of chest pain, like a heart attack, but it's related to this coronary artery dissection. We've only seen it in 3 premutation carriers, but it's something to think about. Here is one premutation carrier, 56-year-old woman with 88 repeats, no cardiac history or connective tissue problems. She had some fibromuscular dysplasia in her internal carotid arteries, had lots of neuropsychiatric problems, including anxiety and depression, experienced significant emotional distress for years because of her son with Fragile X, who became more aggressive. And she had dissection of this coronary artery here with sudden crushing chest pain, which suggested a myocardial infarction. And she had this spontaneous coronary artery dissection right here. So this can be treated with anti-hypertensive medications and sometimes stenting. So it's important to think about. I actually am looking into aneurysms that we see commonly. In fact, I got an email just before beginning this talk about another carrier who had an abdominal aneurysm. So these kind of connective tissue problems can cause aneurysms. Just to sum up, many of these problems here on the right are associated with the premutation. There can be environmental effects, including alcoholism, opioids, when you're addicted to opioids, particularly because of chronic pain, or when you're exposed to toxins, or smoking, or trauma to the head, such as in soccer that's repetitive, or in boxing. We think this can lead to more problems in the central nervous system. Iron deposition also occurs. And then these molecular hallmarks, RNA toxicity, sequestration of proteins. My husband has done most of the work on this. The mitochondrial dysfunction, which occurs in carriers even before the onset of FXTAS and is likely related to some of the emotional problems and even the FXPOI. So Cecilia Giolivi and Ellie Napoli and her team have done the mitochondrial work. And now I have to show you my handsome husband again. Here he is now. He's done the most work on RNA toxicity. His most recent paper under review by Dr. Holm in his lab really looks at how these premutation excessive RNA can lead to ubiquitination of many misfolded proteins that can't be degraded by the nuclear proteasome, which gets overburdened, kind of like a clogged toilet. The proteasome gets rid of many proteins, and as he has analyzed the inclusions, he finds that SUMO12 and P62, these are other proteins that get bound into the inclusions, which occur in these cells where the proteasome is clogged. He does not find FMR poly G in the inclusions, so we think that that's not so important for the RNA toxicity. Although when the FMR1 gene is driven in many of the animal models, the FMR poly G can occur more frequently. He has done also Fred analysis with Kyung-Mi Kim, our statistician for our genotype phenotype study, looking at the levels of proteins in all of the different allelic categories. And as you can see here, in the premutation, sometimes they have elevated protein levels, and sometimes the protein levels can be slightly lower than normal, as we mentioned in the upper end of the premutation. And then mosaic individuals and females with Fragile X syndrome can have higher levels of proteins than males with a full mutation that's fully methylated. And he's also done protein IQ correlations with premutation carriers and those with the full mutation. And so these kinds of studies are very important to see how much you have to turn on FMRP production to salvage the IQ. Now, we have also published on many different treatments for premutation carriers, how to stay healthy with the premutation, stimulating neurogenesis, with which SSRIs do. That means making of new neurons, and exercise does this too. Reducing oxidative stress, and we think that supplements can be helpful, and even mitochondrial promoters. Alleviating factors that could lead to CNS deterioration, like toxins or sleep apnea or immune dysregulation or hypothyroidism. All of these are very common in premutation carriers. Avoiding toxins such as pesticides, insecticides, smoking, excessive amounts of opioids, avoiding general anesthesia, which can be toxic to some neurons, and giving yourself lots of cognitive stimulation. So these are the recommendations that we give to premutation carriers. Now, we've done some treatment studies in FXTAS, including looking at memantine, which didn't help the tremor and ataxia, but a subgroup had improvement in event-related potentials, as Dr. Olichny's lab has demonstrated. So it can, memantine can improve recall and even attention in carriers through this controlled studies. We've also studied allopregnanolone with the help of Mike Rogowski, used IV, and hopefully Mike Rogowski's lab will demonstrate that a nasal infusion of allopregnanolone may work well. This can help the neuropathy and perhaps some neurocognitive measures in FXTAS, so we look forward to doing those studies with a nasal preparation in the future. We are very excited about Anavex 2-73. We have raised money related to private donors to do an open label study of Anavex as soon as it's approved by the FDA. We've submitted a grant to the DoD for a controlled trial of Anavex in FXTAS. And Anavex 2-73 is a sigma-1 agonist. It works right here between the endoplasmic reticulum and the mitochondria, and it can reduce mitochondrial dysfunction. In other words, it helps boost mitochondrial problems in premutation carriers. It can reduce the protein misfolding, which goes into the inclusions. It can improve the calcium dysregulation. It can dramatically reduce oxidative stress, reduce inflammation, and enable neuroprotection. Now, I know a little bit about Anavex because I have done the controlled trial of Anavex 2-73 in Rett syndrome. This is a different form of autism related to an MECP2 mutation. And Anavex Life Sciences funded a Rett syndrome study using this compound, and it was helpful for Rett syndrome. They announced this, that it was beneficial for Rett syndrome. It's also been shown to be beneficial for cognitive deficits in Alzheimer's disease, also beneficial in the animal models of Fragile X syndrome, even depression, multiple sclerosis, also helpful in Parkinson's disease, and they just demonstrated efficacy in Parkinson's disease dementia. So Anavex is a medication that can help both neurodegenerative and neurodevelopmental problems. This just shows the results of Anavex in Rett syndrome, where it improved the Rett syndrome behavioral questionnaire and the clinical global impression scales. This is Warda, who is our coordinator for our Rett syndrome study. She did an excellent job, and we were one of multiple centers that was in this Rett syndrome trial. It may turn out to be a helpful medication for other forms of autism, but we are very excited to try it actually in FXTAS. Actually, when it gets on the market, I'm ready to be treated with Anavex because in aging, it is the mitochondria that age that gives you many of the problems of aging, even cognitive decline. But here is all of the things that it helped with Rett syndrome, the mitochondrial dysfunction, the calcium dysregulation. It helped with the chaperone proteins to restore calcium hemostasis, and helped with reducing activation of cytokines, reducing oxidative stress. It lowered the excessive glutamate and improved dendritic spines in Rett syndrome. So it can be a very helpful medication. Now I'm going to take you back to Fragile X syndrome. Here are 3 brothers who have Fragile X syndrome, showing you the hand mannerisms, the poor eye contact, even the hand biting seen in Fragile X syndrome. These show some of the unusual sensory responses. This overweight boy has what we call the Prader-Willi syndrome of Fragile X, where there is excessive overeating. Actually, Steve Nowicki, one of the developmental and behavioral pediatricians in Davis who trained with us several years ago, he and Flora Tassoni found a molecular marker, lowered levels of CFIP in the blood of individuals with those with the Prader-Willi phenotype of Fragile X. They don't have the Prader-Willi mutation, but they do have some of the molecular dysregulation. So individuals with Fragile X are usually happy, overreactive to sensory stimuli. I want to point out that Fragile X involves many individuals in a family. The circles are girls, the squares are boys, the dot in the middle means they are carriers. So this grandmother of these boys here and girls had 80 CGG repeats, and she had FXTAS, FXPOI, and cognitive deficits. This son is a carrier of the premutation, and then all of the daughters of carrier males go on to have the premutation because they pass their only X chromosome to all of their daughters, but their Y chromosome to the boys. So the boys are unaffected with the premutation. Sometimes you see families, particularly from the Middle East, where both parents are carriers because there can be some consanguinity or marriages within the family. And here we have both parents who are carriers with 75 repeats in this mother and 60 repeats in this father. So the 75 repeats expanded to 120 in this girl who is a double heterozygote, and the 60 stayed as a 60 from the father because it stays as a premutation and doesn't go to a full mutation. But here the premutation went to a full mutation in this girl. So double heterozygotes can do well. Also, she did not have intellectual disability, but anxiety and ADHD, but none of her children will have a normal allele. They'll either have the premutation or this 120 will always go to a full mutation when it's passed on. So here are boys with Fragile X syndrome, and then sometimes it takes another generation to get to a full mutation. So these families are very much involved with multiple family members with either the premutation or the full mutation. Those with Fragile X syndrome, as this gentleman, oftentimes can have sensory modulation problems, a lack of habituation because the GABA or the inhibitory system in the brain is underactive. So he's overreacting to too many pictures. This just shows his sweat response to sensory stimuli here that is overreactive with these repetitive stimuli compared to normal individuals here. So he has an enhanced sympathetic response and a decreased parasympathetic activity. And this can lead to outbursts because they get an enhanced sympathetic response. So many of our treatments are related to calming down the anxiety and the enhanced sympathetic response. Here is an old study that we did looking at macroorganism or large testicles in individuals with Fragile X syndrome. And these lower 3 lines are the normal size in testicles. And testicles can begin to increase at about 8 to 10 years of age. There's too much protein in these testicles and unusual connective tissue. And the macroorganism is a very telling feature from adolescence on. They don't get excessive, well, they get excessively large, but they don't continue growing after late adolescence. They also can have double jointed thumbs, loose connective tissue, enhanced hyperextensibility of the fingers. They often can have strabismus, as this young boy does. Notice he has a long face and prominent ears, and the strabismus is subtle to see, but it needs to be picked up early on in childhood or they can develop amblyopia. And he did have amblyopia at 7 years of age by the time he was sent to ophthalmology. They can chew on their shirt excessively, and that's why his shirt is ragged. And hyperactivity, impulsivity, short attention span, executive function deficits, anxiety, autism, ASD, mood instability, and outburst behavior are the main features seen in Fragile X syndrome. I want to point out that there are areas in the world with a very high pocket of prevalence. We've been to Indonesia, where the pedigree goes across 4 sides of a room. Here's Louise working with us in Indonesia with Sultana, our main collaborator in Indonesia, in Java at Diponegoro University in Indonesia. This is a village that has 50 individuals with Fragile X syndrome, another pocket. We've worked in Colombia, where there is a pocket of Fragile X in Recarte. And we've worked, this is near Cali in Colombia, South America. This little girl is in a Fragile X family. This is her mother who has FXTAS. These are 2 of her brothers who have Fragile X syndrome, a sister who's negative, but she has both Fragile X syndrome and Down syndrome. Very anxious and did much better with sertraline. There is also a pocket in Cameroon, and a paper that's in press now where the king of Cameroon has a family with Fragile X. Here is in Ricarte, many of the older individuals with Fragile X, and there are 3 founder families in Colombia with Fragile X syndrome. And again, as I mentioned, I spent many years looking at treatments for Fragile X syndrome, the standard medications that we give. It's important to remember that OT, speech and language, and PT, along with prompt therapy using tactile stimulation to the mouse, the Early Start Denver model developed by Sally Rogers, and others here at the Mind Institute, where it's studied in more detail, also works for Fragile X. We also put everybody on antioxidants, along with trying the standard medications, but I want to spend more time talking about targeted treatments. So the absence of FMRP, particularly in boys with Fragile X, but deficiency in girls with Fragile X, disrupts a number of mechanisms. So we know that FMRP is very important to transfer the messenger RNAs for many hundreds of genes to the synapse. And there it controls the translation of many messenger RNAs into the proteins important for synaptic plasticity. But when FMRP is absent or deficient, there's typically too much glutamate because of upregulation of the mGluR5 pathways, too little GABA or the inhibitory pathways, downregulation of the GABA receptors. There's actually lowered levels of cyclic AMP, a very important energy compound made by the mitochondria, dysregulation of dopamine pathways, and also oxidative stress. So the targeted treatments really focus on the glutamate, the GABA, and the cyclic AMP areas. This is the mGluR5 pathway that's upregulated. I want to point out this MEK-ERK pathway, and we've studied lovastatin to lower this. This is the P13 kinase, P10 mTOR pathway that's also upregulated in Fragile X syndrome, and we've tried many different mGluR5 antagonists and other proteins to impact this pathway. I'll talk about metformin, which lowers this mTOR part of the pathway. We studied minocycline in the path with Mary J. Lee and found that it was helpful in Fragile X. We looked at arbaclofen, which upregulates the GABA-B pathways. We've studied allopregnanolone, important for the GABA-A pathways, and I'll talk about other targeted treatments, but the mGluR5 antagonists from Novartis and Roche were not helpful for adolescent and adults with Fragile X syndrome. We don't know yet about the 3 to 6-year-old individuals with Fragile X syndrome, so we're doing this NeuroNext study together with multiple other centers. Sumra is the lead coordinator at our site for this Fragile X Learn trial. This is a very long and complex trial for these young children with Fragile X. It also involves parent-implemented language intervention, or PILI, developed by Len Abadudo and his team. For part of this study, we're looking at the effects of PILI together with the medication. This whole study lasts for 21 months, so we're not yet finished with this study, funded by NeuroNext, part of NICHD. So we'll learn in the near future. I want to point out that our baclofen was not helpful. This is the GABA agonist, was not helpful for the adults with Fragile X, but for the children with Fragile X, it did turn out to have somewhat positive effects for some of the subtests. Then the Seaside company actually went bankrupt when it didn't show clear efficacy. It was bought by Autism Speaks and more recently bought by Allos, and they will be doing more arbaclofen studies in both Fragile X syndrome and in autism spectrum disorders. I want to focus on sertraline. It's an SSRI, but because We know that the levels of serotonin can be deficient in young children with autism. And also, we think in young children with Fragile X syndrome, we looked at low dose sertraline, 2 to 5 milligrams per day in young children with Fragile X syndrome. And it did help. This column to the right and also here to the right showed that both receptive and expressive language was improved with young children on sertraline. This was Ian Warnarni, one of our trainees from Indonesia demonstrated this. So we were able to do a controlled trial of sertraline and Fragile X, and it did show significant benefit. Dr. Grease Hess, who was one of our trainees, along with our speech and language pathologist, demonstrated efficacy here in many of the subscores. This shows how many months better on sertraline compared to placebo, and many of them significant. So we typically use low-dose sertraline in young children with Fragile X. Those individuals who have Fragile X plus autism, and that was about 60%, did significantly better on expressive language also, even though it didn't show up for the overall group here, as well as these other subtests. So we do use sertraline routinely. When we did the same study in individuals, young children with ASD without Fragile X syndrome, we did not show efficacy. And this is Laura Potter, who is now a first-year medical student, but was our coordinator for this study. And she is at UC Davis, first-year medical student, along with Forrest. So sertraline doesn't work as well in those with idiopathic autism, maybe because the anxiety is not as severe as it is in those with Fragile X syndrome and autism. So we've used other GABA agonists. This is ganaxolone. It was not helpful or not significantly helpful on the Clinical Global Impression Scale, but it was helpful in those who were the most severely anxious. This was done by Andrew Ligsay, who is finishing up a pediatric residency down in UC San Diego. And we looked at another GABA agonist, gaboxidol. This was looking at 3 different doses of this GABA agonist. It was helpful, but it wasn't a controlled trial with a placebo. So they will be doing more studies of gaboxidol. The company is Ovid, and they will probably try this in other types of autism also, since anxiety can be a problem for the majority of individuals with anxiety, and has been shown, autism has been shown to have low GABA levels similar to Fragile X syndrome. Now, trofenatide is an IGF-1 analog. It's just the bottom part of this IGF-1 protein. It was shown to be beneficial in animal models for Fragile X, and in the controlled trial that we did in Fragile X syndrome, trofenatide was significantly helpful in adolescent and adults with Fragile X syndrome. But more recently, it has been tried in individuals with Angelman syndrome, and also in Rett syndrome. And so we will be doing some of those studies here at the Mind Institute. I want to focus on metformin. This is a type 2 diabetes medication. It's a glucophage because it lowers glucose or eats glucose in the bloodstream. So it suppresses the making of more glucose in the bloodstream. It increases insulin suppression of glucose production by the liver, reduces absorption of glucose in the GI tract. It activates the mitochondria through AMP kinase, and it lowers the level of mTOR in Fragile X syndrome. So remember that mTOR pathway was too high in Fragile X syndrome. So it's a type 2 diabetes medication that is also FDA approved for obesity. It helps you lose weight and it helps decrease your appetite. And so those individuals with the Prader-Willi phenotype of Fragile X have lost weight on metformin. It helps the animal models of Fragile X. It rescues the Fragile X mouse, as Dr. Gantois has shown. And we have done trials where it was helpful in many patients with Fragile X syndrome. Now, metformin has been around for a long time. Even in 1500 BC, it was written up in papyruses. You can get it from different plants. This is the French lilac. It was touted as a helpful medication, again, by the Egyptians. It has many effects. It actually lowers inflammation. It lowers the production of many proteins, particularly stimulated by the mTOR pathway that makes tumors grow. So it actually is prophylactic against cancers. By lowering blood sugar and lowering high blood pressure, it actually helps vascular dementia in the sense that less glucose and less hypertension helps the brain and helps you avoid dementia. So it is a beneficial medication. We have started a controlled trial funded by the Azraeli Foundation in Canada. So it takes place both at the Mind Institute and at 2 sites in Canada. And this is the great thing about doing research is you get to travel and collaborate with many other people. So Francois Bolduc, pictured here, and our old friend Sébastien Jacquemont, who is in Montreal now and heads a big center in Montreal. And Francois Bolduc is in Edmonton in Alberta. So the Azraeli Foundation funded this 3-site study, which has amazing outcome measures and amazing biomarkers for Flora and Paul to look at. And here we're visiting our team in Canada, and we have ERP, eye tracking, behavioral measures developed by David Hessel, like the NIH Toolbox for Cognition in individuals with Fragile X. So we think if it's going to be efficacious, we will be able to see it. Now, we have had a lot of experience because we've seen such positive anecdotal study, and we've looked at this in young children with Fragile X. These are individuals between 2 and 7 years of age who did well on metformin in young children. This is published. And we can't wait to see the results of the controlled trial. Our collaborator, Dr. Protek, who came here from Serbia, she has done much research with us, but she reported individuals who had improvement in IQ in adulthood with 1 to 2 years of metformin. Here's how the weight can come down with metformin in individuals with the Prader-Willi phenotype. And this individual, when he went into puberty, he had normal-sized testicles. So it may even help the macroorchidism in individuals with Fragile X syndrome. It started before puberty, and we need to follow up on many of our patients now who have been on metformin. So I want to point out that metformin even helps with COVID. And actually, this just shows how much better individuals on metformin have done with shorter hospitalization, improvements in morbidity and mortality. And a new paper in JAMA shows that particularly women have less severe COVID symptoms by 25% when they are on metformin. So needless to say, metformin can be helpful for a lot of people and not just individuals with Fragile X syndrome. We have yet to do metformin studies in carriers, but I have many carriers who have done well with metformin. I even take metformin for prophylaxis against cancer. So I want to talk about CBD, or cannabidiol. Now, FMRP controls the cannabinoid system, and CBD, not tetrahydrocannabinol, which is the psychotropic part of marijuana, is likely to be helpful not only for Fragile X syndrome, but ASD and maybe even premutation involvement, especially for anxiety, sleep disturbances, and pain. CBD is actually a GABA-A agonist. There are many families who have gotten CBD tinctures through the internet, but Zynerba is a company that has made ZYN-002, a topical CBD ointment. It has absolutely no THC, comes in a packet, you put it on your hand, and then you rub it on the shoulders. So we have done a controlled trial of CBD, the Connect Fragile X trial. It has taken place in Australia and at multiple sites in the US. And they recently announced that it was clinically meaningful and had a significant improvement in those that had the full mutation that were fully methylated. And here you see how much better they are in the ABC subtests: social avoidance, irritability, social unresponsiveness, significant benefit here. Not in the full group, although it was a little bit better, but not statistically significant, close in irritability, but also in the parent ratings of the CGI-I, how much clinical improvement they had for social avoidance, social interaction, and disruptive behavior. It was beneficial. So the FDA did not give them immediate approval. They wanted another study done in this group that was fully methylated. Actually, 80% of the overall treatment group was fully methylated. And the numbers are big here, 76 on placebo, 91 on Zynerba. But we are very hopeful that this will sooner or later be FDA approved. They're also doing studies in autism without Fragile X. So we look forward to those. I want to point out that Tetra Therapeutics has a compound called BPN 14770 that raises cyclic AMP levels. Remember how I talked about cyclic AMP, this energy compound? Liz Berry-Kravitz discovered very early on, years ago, I think more than 20 years ago, that cyclic AMP was deficient in Fragile X. And so this phosphodiesterase 4D, called PDE4D, it's an allosteric inhibitor of the compound that breaks down cyclic AMP, so it stimulates the levels of cyclic AMP. This was studied in 30 adults with Fragile X syndrome in Chicago in a controlled crossover study, each period lasting 12 weeks. Their main outcome measure was the NIH toolbox that David Hessel developed for Fragile X and other causes of intellectual disability. And it showed a significant benefit in oral reading recognition, picture vocabulary, cognition, crystallized composite score. So it seems to improve cognition and caregiving ratings on language and daily functioning. So Tetra is empowered now to carry out both studies in children and adults with Fragile X. And we will be doing these in the summer of 2021 at the Mind Institute. So this may be a very important medication for improving cognition and language in those with Fragile X. Now, I want to point out, I don't want to emphasize just medications, although that's what I know the most about, but David Hessel has done a CogMed study looking at an electronic game to improve ADHD symptoms in Fragile X. Also, the PLE intervention, parent implemented language intervention, when we paired this up with a controlled trial of lovastatin, Angela Thurman and our own Len Abadudo, our director of the Mind Institute, and their team developed this PLE intervention, and it was just as good as lovastatin. It improved many areas of functioning just as well as PLE when PLE was done. Parent implemented language therapy through telemedicine with the parents. There are other apps that Maria Diaz, remember this ARTP trainee who now has 2 kids in Barcelona. She has done much related to learning apps. Here's a picture of Ophi, who also worked with us from many places in the world and has done many studies with us. So we want to thank all of our trainees and faculty here who work on these medications. I want to say that future trials in Fragile X and autism will include bumetanide developed by Neurochlor, but this is an old medication. It is an NK-CCI antagonist working on this sodium-potassium channel. It reduces the excitatory GABA signaling that is problematic in early phases of autism and also Fragile X syndrome before GABA becomes an inhibitory system. They are doing multi-center studies, not only in Europe, but in the US. Allos Pharma, as I mentioned, bought our baclofen, this GABA agonist, and will be doing further treatment studies in Fragile X syndrome and also likely in autism. There will be further trials of CBD from Zynerba in Fragile X and also in autism. There will be studies of bryostatin, which is a protein kinase alpha medication that activates PKC alpha, rescues autism and cognition in the Fragile X knockout mouse. There's a trial starting in Australia with a drug called Xanamem, which is a drug that blocks excessive levels of cortisol that is increased because it's a stress hormone increased in Fragile X. This medication is, or the trial is called Xana-FX in a phase 2 trial in adolescent boys with Fragile X syndrome. So we'll see what happens with these other medications, and we may be trying it here. I want to point out that the treatment in the near future will be stem cell therapy and gene therapy. And we are hosting this year in September, probably both an in-person and online study, bringing individuals who have developed stem cell and gene therapy for neurodevelopmental disorders here to the Mind Institute with a particular focus on autism and Fragile X. You know, we're already doing stem cell therapy for SMA, spinal muscular atrophy, where you can put the normal gene inside of either an AAV virus and inject it into the spinal fluid, or maybe into the patient's cells themselves and having them get into the brain through the microglia. So we think that this will be significantly helpful in the near future. And we hope that, I gotta turn off my phone here. We hope that these gene therapy and stem cell therapy will start soon. Of course, all of these therapies depend on money, but I gotta sit down with Jen Nolta and her team to write Fragile X and FXTAS grant. I wanna point out, this is an international workshop. This is Francois Boldeck. And people from the Mind, here's Paul and I, and Flora is in here someplace, and many of our other collaborators. Pietro is starting a metformin study in Italy. And this is another reason why we do research. There's great travel, and it's just wonderful to collaborate with our international faculty. And this is why research is so great, because you get great ideas and new treatments from all of these great minds around the world. Flora, seen here, is organizing, along with Paul and I, the next Premutation meeting in New Zealand in March 2022. So all of you thinking about research, this is a great meeting to present your research at. I want to thank a wonderful team. Here's another picture of our team: Andy and Samra, Bella, Chris. I think this is Lisa McCool, Forrest, many others here on our team. And none of this could have been done without a most wonderful team. And remember, the important things in life are the relationships you develop with your team members and also with your families that you treat. And medicine is just, particularly pediatrics and developmental and behavioral pediatrics, is just a wonderful way to go in medicine. So I want to thank everybody. And now we're open for questions. I heard Dr. H discuss the Rett trial and was wondering what her thoughts about the potential benefit for Fragile X with blascarmazine. I think that Anavex 2-73 is going to do great things for Fragile X syndrome also. I think it's very exciting. We want to start with, am I on? Can people hear me? We want to start with FXTAS because I have too many people with FXTAS that are dying. We'll do the Anavex study in FXTAS first, and then I would love to do it in Fragile X syndrome. Okay, I like your webinar very much and the enthusiasm on Rett the other day. Like that Anavex 273 could help on Fragile X and other neurodiseases. Do you think Anavex is approvable by the FDA for adult Rett syndrome based on the phase 2 relative low dose? Yes, I hope that the FDA will approve Anavex for Rett syndrome. I hope they do, and I think they should, because it was very helpful for Rett syndrome. So we shall see. I'll contact the people at Anavex to see if it got approved yet. I just don't know the answer, but I hope it did. Does Dr. Hagerman think that 2-73 will work for all autism spectrum disorders and further all CNS diseases and perhaps even as a tonic to all people and ages? Well, you know, I hate to be overly global, but I think any individual with autism that has mitochondrial dysfunction, I think that Anavex could be helpful for them. So I am very positive. I would love to do Anavex 2-73 in autism spectrum disorder. Actually, as I mentioned, I think it could help everybody who ages with mitochondrial dysfunction, and everybody in aging has mitochondrial dysfunction. So I think it could be very helpful in aging, but definitely protective against some cognitive decline in Alzheimer's and in Parkinson's disease. What is the best way to initiate testing with your healthcare provider? Oh, just ask them to do genetic testing. If you're worried about Fragile X syndrome, then Fragile X DNA test. In autism, they should get Fragile X DNA and a microarray, and maybe later whole genome sequencing. So Gail, I see there, as a premutation carrier, can I ask my physician about metformin? Is the metformin XR safe? I think it is safe. It doesn't cause hypoglycemia. If you go up on the dose slowly, if you get diarrhea, you go up even slower, you cut back on the dose, but it's protective against cancer. I have seen many carriers have benefit, but we haven't done a controlled trial in carriers yet, but we hope to do that in the future. You mentioned our baclofen showed promising results in younger children. My son was in the trial with positive results when he was 5 or 6 years old. He's now 14. Is it possible he might still have similar results? Yes, it is definitely possible. I think when we did the arbaclofen trial in Fragile X, there were some that had a great response, others that didn't. And I think if your son had a great response in the past, he would still have a good response. So we hope to have an arbaclofen trial in Fragile X again now in adolescence and adulthood. Okay, how would someone go about donating their brain or other organs to research associated with Fragile X and FXTAS? Yes, you can email me and I will link you up with our team that takes, does a consent for brain donation. And it is amazing what the research has shown in FXTAS, but also is shown in Fragile X syndrome. I didn't have time to talk about the brain results in Fragile X syndrome, but we urge you to donate your brain to our brain bank. What is the appropriate metformin dose for a male adult with Fragile X syndrome? So we start with just 500 milligrams at dinner, and then each week we go up 500 milligrams till they're taking 2 500 milligram tablets twice a day, which is the adult dose, but you got to go up slowly over 4 weeks to avoid diarrhea or other side effects. If they don't tolerate the 2 tablets twice a day, you could stick with 1 tablet twice a day. So you just need to go up slowly. Have you taken a hard look at the side effects of these medicines mentioned? Where can we find that information? So in all of our papers, we talk about the side effects, whether they are increased compared to controls, and whether there was a significant difference, and any other problematic side effects. So sometimes you have a medication that causes an allergic response or a rash or a significant, more negative reaction, and then you just stop that medication and you can drop out of any of these studies when you participate if you have a negative reaction. So Suma, thank you. Suma, given Fragile X is a neurodevelopmental, neurodegenerative disorder, what kind of treatments would be ideal to be begun early in childhood and infancy? So I think you can't go wrong with antioxidants, and most of these are supplements that you get. We've also found from 2 years of age and older in Fragile X syndrome, we think that low-dose sertraline can be beneficial. As I mentioned, I think metformin can be helpful. We'll have to see about the neurodegeneration with FXTAS and whether it responds to Anavex, but I think it will. So I'm very hopeful about that. What is the relation between a leaky heart valve and Fragile X syndrome? So as I mentioned, Fragile X syndrome has loose connective tissue, and oftentimes the mitral valve is floppy. We know that the elastin fibers are diminished in the skin and also in the valves in individuals with Fragile X. So when you have mitral insufficiency, and sometimes it can involve other heart valves, this can cause a murmur, and oftentimes you can see if there's a valvular insufficiency on an echo. So it's related to the connective tissue problems and the elastin fiber problems. My son's doctor won't prescribe metformin for our son because he said it is off-label. Any suggestions to convince him? Well, I would give him all the metformin papers that I've sent to you, and hopefully he will be convinced because it's a targeted treatment in Fragile X, helpful in the animal models and the human models. Oftentimes medications we get that are targeted treatments are off-label, because it takes a lot to get the FDA to approve it. But I think that you can cross-email your doctor to me and I'll work on him too. is there any way to try the medications outside of being enrolled in a clinical trial? It depends on what medications. So the sertraline can be prescribed, the metformin can be prescribed, the CBD can be obtained online. There is a Fragile X family that does the www.Jupiter CBD online venue. It's organic, and the family gives the Fragile X population a 20% discount for CBD. And I think their CBD products are quite good. Very, very little THC in their tincture. So that would be good. What do you think the odds are of funding a controlled study of Anavex 2-73 by the DoD? Well, we hope to find out this month. I think we have at least a 50% odd trial chance that it will be funded. What is the recommended dosage for metformin for FXTAS in women? So the adult dose, as I mentioned, is 2 500 milligram tablets twice a day, but you have to go up very slowly. We don't know whether metformin is helpful for FXTAS. It may not be helpful for FXTAS, and most likely won't be helpful for the tremor and ataxia, because we have a lot of individuals with FXTAS that develop type 2 diabetes and are on metformin, but they still progress in their tremor and ataxia. But I think it can help with prophylaxis against cancer, help with lowering hypertension and lowering the glucose level, and maybe helpful for metformin for protecting against COVID to a certain extent. Can an adult with chromosome 18q- syndrome, autism, epilepsy, and other health impairments have Fragile X syndrome and be tested for it? Absolutely. We've seen just about all chromosomal problems that can occur together with Fragile X syndrome. We've seen Down syndrome, 15q deletion. All of the sex chromosomal abnormalities can also occur together with Fragile X. So it's possible to have Fragile X and any other cytogenetic abnormalities. So you just have to have your doctor do Fragile X DNA testing, or the mom can be tested, because the mom has to be a carrier or a full mutation herself to see, unless the child is a female, and then the child could get a premutation from the father. Do you have a list of antioxidants for Fragile X syndrome 2 years old? So omega-3, curcumin in food, green tea, berries, fresh berries, all of these are good antioxidants. I think they could be helpful. If a trial of Anavex is improved, how does one enroll in it? Well, if it's an Anavex trial occurring at our center, you better contact me by email, rjhagerman@ucdavis.edu. Just missed the name of the CBD company that was just mentioned. It's Jupiter is the CBD company. So www.jupiter.com is the CBD company owned by a Fragile X family that gives the Fragile X families a 20% discount. But it's a great CBD company that is organic. Can I look at one more? Daughter and mother with a premutation with ASD are in your study in 2014 and now in a movement disorder clinic on a higher dose of baclofen, but spasticity is severe with myoclonic jerks, anxiety, treated with clonazepam. Will metformin, Anavex work? And usually before her period comes, behaviors with spasticity are more severe. Any hormone influences involved? And also, can we, with our dilemma and medication, call you in consultation, Dr. Hagerman? We also asked to participate again in more targeted treatment trials for her. Absolutely. I think it's best to just call me and we can discuss this by phone.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.